Hi there, it's Dr. Mary Barbera here for our Monday Q&A session all about autism. And welcome to both parents and professionals as well as other caregivers of children with autism, grandparents, aunts, uncles, anybody interested in autism. My information may help you. So if you are joining me, please let me know in the comments if you're a parent, professional, or other relative or friend. Also ask if you have any questions. So I'll just wait a second and make sure everybody can hear me and see me. I know last week I kind of got a little started and realized I didn't have a mic going. So, yeah, if you can just help me out. Okay, so I can see that I am on. I look like I am broadcasting. So, I'll get started. Today I am going to be covering a really fascinating interview that I had on my podcast, episode number 70. With Kate Swenson from Cooper's Voice, but I'm going to wait a little bit, wait to see, have people come in and get settled and make sure we have everybody here before we start covering the main topic. Okay, so, okay, so we are getting echoes. Okay, let me see why we're getting echoes. Okay, I am going to close out Zoom. And I think I'm going to leave Zoom altogether. Okay. Okay, so let me see if what I just said helps the echo problem, because I was trying to Zoom and broadcast, so I shut that down now. And let me just have a minute to see if that's going to work. If it doesn't, then I can stop and try to restart. Always lovely technology, you know how that goes. Okay, let me just... okay, so if Kara or Sam can help me, and okay, so it's fixed. So I got rid of Zoom. We tried Zoom last time and it worked fine, but something is amiss. Okay. Starting over. Okay. Deep breaths. Technology at its finest. Okay, so I am Dr. Mary Barbera. I come on every Monday at 1 p.m. Eastern Time, and I am broadcasting. I usually pick a topic. This week, I am going to go over some of the insights that I got by interviewing Kate Swenson from Cooper's Voice, Finding Cooper's Voice. I'm also going to be answering your comments or questions live. So if you are a parent or a professional, you can get on and ask me a comment or ask me a question, and I will try to get to it. Obviously, I can't answer specifically what you should actually do if you say, so try to make your questions more general in nature, because if you tell me, okay, I have a 3-year-old who is throwing themselves on the ground, what should I do? Obviously, I'm not going to be able to answer that because it's very specific to your child. I don't know 99.9% of the information that I would need to get you help. So for those of you that don't know me, I fell into the autism world in the late 1990s when my firstborn son, Lucas, was diagnosed with autism one day before his third birthday. I have since transformed from a very confused parent, not knowing much about autism back in the late 90s, to a autism professional. I am a registered nurse, a behavior analyst. I have a PhD. I have a best-selling book called The Verbal Behavior Approach. I'm working on my second book, which is going to be even bigger, hopefully. So I also am an online course creator. So I have two courses. I have my toddler preschooler course for parents and early intervention professionals who want to help kids ages 1 to 4 or 5. And then I have a verbal behavior bundle course and community, which helps parents and professionals of kids of all ages. And both groups are going strong. I started my first online course 5 years ago. I also have a podcast, and we're going to talk about Kate Swenson's podcast interview. That's episode number 70. So if you want to listen to that podcast from start to finish, marybarbera.com/70 will get you there. Okay, so let me look at the comments that we have so far and see. Okay. All right. So the sound is all good. Thank you so much for bearing with me. It seems like every time I do something live, there's a new little glitch. And so we'll work it out. Thanks for hanging in there. Okay. I have a question. I worked with a child who's 5 and nonverbal. He speaks only new words and then he suddenly stops speaking them. What suggestions can I have to motivate him to speak more fluently? A lot of my early learner programs within my courses really show things like a shoebox where you gather pictures of words that the child has already spoken and present the words in one picture, one at a time. And those techniques, and the child doesn't have to actually say the word. He just has to take the word and you say the word cat, cat, cat. He needs to put it in the box. But that repetition, saying words slowly, more animated, breaking words down, can really help a child gain more fluency. You can't force a child to speak. Even if he said the word 100 times yesterday, there's no way you can make him say the word again. So these techniques are ways to encourage independence, encourage fluency, encourage engagement, which during the COVID-19 shutdown is more challenging than ever. I've done a couple of my live presentations have been about really talking about how hard it is to engage kids who are on the spectrum or showing signs. It's hard to engage all kids, but especially kids with autism or language delays. Okay, my son is going to be 3 years old this May. He doesn't utter a word or join his daycare kids to play. He watches kids from afar. And then kids scream at my son and make him cry. So, gaining some of these skills through these live Q&As, listening to my podcasts, video blogs, can all help. But really the best way I know how to help you is to actually join my online course and community where you can learn step-by-step what to do, because you have a lot of issues going on. You've got your child who's not talking, now he's crying. You've got kids, he doesn't know how to play, kids making fun of him already, just all kinds of things. So if you can take a free quiz at marybarbera.com/quiz, that will be your best bet to getting some more information in a very systematic way, some free information to learn more about what you can do to help. So, yes, I would say, let me just quickly just going to change this to quiz so I can put this up on the screen. Bear with me 1 second, because this quiz is actually fairly new. Just created it a little while ago, and it will really help you, whether you're a parent or professional or grandparent. It's going to really help you get to the right place within I have so many, video blogs and podcasts, and really I help both, parents and professionals, toddlers through teens. So you want to get the right information. And so by taking this quiz, you answer a few questions. It'll only take about 2 minutes. You answer a few questions, and then I can actually quickly send you the best free workshop to learn the best information just to get moving. Okay. Let me check here for comments. I am going to dive in a little bit to this podcast number 70. Okay, Valerie has a question. Can you point me in the best discussion of difficulties with yes, no due to apparent lack of processing? Question for meaning. Yeah. So I do have a video blog on yes and no. So if I say I have a video blog or a podcast, you can just search Mary Autism yes and no. And I have a video blog. I actually created a whole system for teaching kids yes and no. And yes and no is actually really complicated, which I didn't realize until I started working with my son, trying to teach him yes and no. So first yes and no is, do you want water? And a lot of kids with autism, when they don't have a lot of language, they'll just echo water, and then you'll give them water, and that's fine. Some kids like that, I would actually advocate for teaching them to shake their head no or say no if they're pushing it away, just to reduce problem behaviors and not actually teach them yes. But when they're ready for yes, first is, do you want water, which is a reinforcer, insight, or something they don't like. So for my son, we might have used raisins. So I remember we used a VHS tape that he did not like. So we use that for no, because you don't always want to ask things that are yes. You actually have to answer things that are no too. So manding yes, no, in sight. Then it's, do you want water when it's not in sight, yes or no? Then it's, is this a pen? Is this a water bottle? That's tacting yes or no, and that's really tricky. It took me 4 years of having manding yes and no and not having tacting yes and no. The final yes and no, which isn't really final, but there's all kinds of intraverbal yes and no, which is, does a cow say quack? So those kind of things are yes and no about items without the item present. So it can get very complicated. So in the yes, no video blog, I describe that. Are professionals still diagnosing ASD mild, moderate, and severe, and is that important? This is a question from one of our members, Ria, who's in our courses. So back when Lucas was diagnosed in 1990, they used the DSM-4, and now they use the DSM-5 to diagnose autism. And DSM-5 is level 1, level 2, and level 3 in terms of severity levels. And when Lucas was diagnosed, it was PDD-NOS and Asperger's syndrome and those sorts of things. So with the DSM-5, you do usually get a level 1, level 2, or level 3, but that can change. And it's a very fluid situation. Like even with my son, I talk about how he was diagnosed with moderate to severe autism 1 month, and the next month he was diagnosed with PDD-NOS. And I had these two professionals in the same room, one a developmental pediatrician and one a psychologist. And I'm like, well, which is it? Is it moderate to severe, or is it mild, not even quite on the spectrum? And they both said, like, what you want to know is what Lucas is going to be like at 8 or 12 or 18. And neither one of us can tell you that. It depends on the day, the examiner, what kind of testing. I remember when Lucas was diagnosed with the PDD-NOS, it was down in Philadelphia, and we happened to get a soft pretzel, which he really likes. And so we were feeding him soft pretzel, and at one point during the administration of the testing, there was like a doll and a plate, and Lucas came over for soft pretzel, but he actually took the soft pretzel and put it on the plate for the doll, which was totally random. But that scored him big points. And so she, that showed pretend play, which he didn't have. It was just bizarre that he put it down there. But so that's an example where a child could look more mild or more severe, based on the day, based on how much sleep they got, based on whether you can be in the room, based on so and it doesn't matter. I did do a video blog, can you tell how a 2-year-old is going to do at age 8 or 18? And the answer is no. Like, I know kids with looked like worse, more severe autism than Lucas, who are now driving and going to college. And he is, looking probably more impaired than he did when he was 2. Michelle said, here with a 26-month-old daughter who went from 2 words to 500 words in just 6 weeks. This is a member of my toddler course who is very, willing to share her success, which is awesome. Not sure how it would work with a Facebook Live, but if you would like, I can share how she used to be before your course. Either way, I'm happy to be watching. Yeah, Michelle, we had some problems with our Zoom link, and we were getting like double talking, but I definitely will take you up on that. Maybe we can even schedule it for like next Monday or something, or I can do a video with you ahead of time and we can show it. Because Michelle reported within our online Facebook community, within the toddler course, that she joined the course. Her daughter had just 2 words, and now she has 500 words, and she's 26 months. And this all happened within 6 weeks. And Michelle is not our only member to be showing major success. We had one woman who, she started the course, and within 2 weeks, her grandson said his first words. We have Abby, who I interviewed recently, and she had a son who was actually talking, but he had very little functional language. It was all scripting or stimming. And got her son caught up within 6 months of my courses. So I am thrilled that you're here, Michelle, and wonderful that you want to tell your story. Just can't tell it right now just because of technical problems, but we'll definitely follow up with you. I'd love to hear more about your story. Kelsey said, I set up activities, but for my daughter, but she cries when she sees them and doesn't want to engage at all. Is this a sign of autism, or could it be a personality, stubbornness? What this tells me, Kelsey, is you just haven't found the right reinforcers. Like, maybe you tried the table time a little too soon. Maybe you didn't pair it up enough. So whenever a child, then that doesn't mean like get a new table, throw out all the materials. Anything can be repaired. So when you are having a child with any kind of problem behaviors, I am a big proponent of table time, but I am a big proponent of pairing up the table and the materials very slowly so the child doesn't see it as work, doesn't see it as demands. So I would just hang tight and go back to the basics. Bring her to the table only for, short bursts of movies and edibles and drink and bubbles and water play and finger paint, whatever she likes, Play-Doh if she likes that. Pair up the table and being with you with a lot of fun. And maybe you need to decrease the shoebox and potato head and put that stuff away for a week or two. And then when you bring it back in a very subtle way. I believe you might be in our online course too. So if you are, post in that community and we will definitely help you. What are your thoughts on links between gastrointestinal issues and autism? Do you think diet adjustments are worth exploring? That's a question from Kate. So Kate, tomorrow I'm having a podcast interview with Dr. Missy Olive, who has a PhD and she's a BCBAD like I am. And that podcast episode is about GI issues and autism. I do believe that the research is pretty clear that kids with autism have a much higher rate of GI upset than typically developing kids do. I do think there's a correlation between that. I do think it's difficult for kids to tell you that they're in pain, which I have some video blogs on. I do think it's hard to diagnose things when a child is minimally verbal. And I do think that, just like we're all trying to eat better. We're trying to be GMO free or MSG free or artificial sweeteners limiting or, trying carb reduction, if we're adults are trying this to control weight, metabolic issues, it makes sense that kids, especially kids with delays, we try to get them to eat as healthy as possible, make sure we look at the medical side of things and don't just try to treat everything behaviorally. Now, I am a registered nurse first, then an autism mom, then a behavior analyst, then an author, then an online course creator. So I don't take off any of these hats. They're all on me. And we are really trying to get kids to reach their fullest potential. So I do think when kids are little, especially, experimenting with diets may not be a bad idea. So that is my thought on GI issues, but tune in tomorrow for podcast number 71. Let me just pull up my phone and make sure I didn't miss a bunch of messages because I'm only showing a couple. So sorry. I am spacing out here. I am going to get to this, the interesting insights from podcast number 70 in just a minute. I seem to have a lot of questions today, which is great. I come on here live every Monday to answer questions from you guys. So, yeah. Alrighty. All right. So yes, no, we covered. Okay. Got all those questions. All the details about the course are, we really want you to get into the right course because I have two different options. So take the quiz first, and everything that's included in the course is also at marybarbera.com/course, I think, courses. But the quiz is really your best bet because I only want people in the course and community who are, gung-ho, ready to learn, and they have the right fit. Like if your child is 8 and fully conversational, then the course is not appropriate. My courses really tend to work best with kids who are not talking much, definitely not conversational, have problems with not only talking, but also learning, tantrums, feeding, sleeping, eating, potty training. Those are where the courses are really beneficial. So it's not just about, there's a lot to it, and there's a lot of bonuses of what's included. So I want you to go through the process and see if it's a good fit for you. And for anybody that it's not a good fit for, taking advantage of these free Q&As, my podcast, my video blogs is a great start. Grandmother of a 2.5-year-old boy who was diagnosed at about 18 months with mild autism. For the most part, he's nonverbal. He started ABA and then COVID came along. So we have several grandmothers in our toddler course right now. They've made miraculous progress with their grandchildren. I also have a podcast with a grandmother, Grandma Diane. So you can search Mary, autism, grandmother, and you'll find that podcast is very inspirational. And the other thing I'll say is, you're saying your grandson has mild autism and he's not talking and he's only 21 months of age. It's really hard to tell. Just piggybacking on one of my answers before, is it's really hard to tell how mild it is. I know in Kate's interview, which I'm going to go over in just a second, she talks about how her son always had severe autism, but she used to say he had high functioning autism. She's like, I don't know why I said that, but I did. So, all right. Is there a medicine that can cure autism? No, unfortunately, there is not a medicine that can cure autism yet. There are definitely some medicines that help. And I have a podcast episode, number 28, marybarbera.com/28, with Dr. Michael Murray, who is a psychiatrist, and he's an autism dad. And he's my son's psychiatrist. And so that's a great episode on medications and autism. Dr. Murray put Lucas on a medication when he was 18 that literally changed his life for the better. So definitely want to check that out. Is it possible for a nonverbal child to gain language? And how can you stimulate that language in a 1-year, 8-month-old? Yeah, we read from Michelle and Rhea, their kids started with the online course. Michelle's son had 2 words. Some kids have 0 words. That's very common. And definitely seeing a lot of progress in most of the kids. All right, so there's still a fair amount of questions here. There's a question about how this online course works. You take it at your own pace, wherever you are around the world. We've had parents and professionals from over 80 countries take my online course, which has been amazing. Okay, so as promised, I'm going to talk for a few minutes on podcast number 70. So every week, every Tuesday, I come out with a new episode of the Turn Autism Around podcast. I started the podcast about 16 months ago. Every Tuesday, I come out with a podcast episode. We are up to episode 70. We've had more than 200,000 downloads of my podcast, so it's very popular. You can listen to my podcast anywhere: Apple Podcasts, Spotify, Google Play, Pandora, iHeartRadio, you name it. Where you listen to podcasts, you can listen. You can also listen, and I would recommend, especially for this podcast number 70, that you actually listen or watch it by going to my website, marybarbera.com/70. Because this podcast, since Kate Swenson is on it being interviewed, we decided to put the whole video up with her speaking so that you could see me talking and you could see Kate talking, because Kate is great on video. So Kate has 3 kids. Just to summarize some of the insights I got, I actually learned something at the very end of the podcast interview that literally has made my stress level go down in the past couple of weeks since we recorded that. So I'm going to share that too. So Kate has 3 kids: Cooper, who's 9, Sawyer, who's 7, and Harbor, who is 18 months of age. And Cooper has severe autism, and that's the one that said that she always kind of said he had high functioning autism when he was little, but it was pretty severe. He started with autism intervention and everything, but he only started getting ABA services, I think, in kindergarten or thereabouts. He has apraxia too, which is difficulty speaking. So he is still mostly nonverbal in terms of his speech, but he does use a speech generating device like an iPad app or something like that. And then he also tries to sound out words, and he's very smart. He can, spell and has pretty good receptive language abilities. He seems to understand a lot, but he can also have tantrums, and he's a big kid. Like Lucas, he's a big 9-year-old. So if he flops to the ground, there's no picking him up. And so Kate started Finding Cooper's Voice as a blog. She's a very talented writer. She's working on her first book called Forever Boy, which will be published at some point. She just got a contract for it. So my second book, which will be called Turn Autism Around, is for parents of little kids, ages 1 to 5, and early intervention professionals who really want to turn things around. That will be out in a year, April of 2021. So Kate just got the contract, so hers is probably out even later than that. It takes a long time to write a traditional book. So my book will be in hardcover. It will be there'll be Audible, and it's going to be pretty big. So Kate is a talented writer, like I said. She's really great, and so she decided to start blogging at Finding Cooper's Voice and started a Facebook page a few years ago, maybe 3 or 4 years ago, and she describes within podcast number 70 how she brought her son and her husband to see Elmo when he was 6. And he had a really hard time. It was crowded. It was at a mall. And he flopped on the ground. And everybody was kind of staring and whispering and holding their kids tighter. And he was melting down. And at that point, she just started to think oh my God, this is forever. And started to really think about even things like what's going to happen when I die. Is he even going to know I die? And all these thoughts. So she did this video in her car where she's crying and she's just telling us about how she's come to this realization. This is a couple of years ago. And the video ended up going viral. And the Today Show shared it. And it had more than 30 million views, right out of the gate. And at that point, her Finding Cooper's Voice Facebook page blew up. Now has 500,000 people follow her. And last year, a little over a year ago, she decided to start a supporters page for Facebook because she was getting so burnt out. She had her 3rd child by that point. She was getting a lot of backlash and mean comments. I guess when you go viral, these things can happen. And so she started a supporter page called Coops Troops, and that's $4.99 a month. I'm a member. It's a very supportive group for moms and professionals, and mostly talking about kids with severe autism. But, there's people in there sharing about kids with mild autism or even people that are just curious about autism and don't really know anybody personally. But she continues. I've been featured on her Facebook Lives, and she's come on my podcast. And we're hoping to, collaborate more and more to help parents and professionals. So Kate said in the podcast interview, the biggest question she gets hundreds of questions via email a week. And the biggest question she gets, which I don't get that much, but should I have another baby is the question she gets a lot. Probably because she has a 9-year-old, 7-year-old, and then they decided and had a third boy. So she gets that question a lot, and so we talk about that. She some other things when I asked her about, like, how can she reduce stress, how does she reduce stress, what kind of advice does she give, and she had some good insight. She said, you have time. Like, you often hear, like, if you don't get a child talking by their 5, or you don't get them potty trained by this age, like, you're missing out. Like, the window's closed. You can't make progress. And we all are lifelong learners. And Cooper's continued to learn, and things have gotten better, actually. She also we talked about medication and how she was very anti-medication. She felt like that was giving up on her son. And then when she decided to do medication, it really changed things for the better. And that was age 8. So he's only 9 now. So they've seen a lot of progress with that. She also said, really be kind to yourself, give yourself grace. Don't be so hard on yourself. Try to have time for yourself and your husband and the siblings of the kids, because it can become all consuming, which is totally, same thing for me. I would give that advice as well. Advice for professionals, Kate said, don't blame autism don't blame everything on autism. There was a question earlier about GI versus autism. Don't say, well, GI, constipation, diarrhea, that's autism, or screaming or biting, that's just autism. No, it's not autism. Not every child with autism bites or screams or throws himself on the ground or has constipation. These are medical issues. They could be behavioral issues too, but you don't have to put up with any of them. It's not just a part of autism. And just because you have a child maybe with severe autism doesn't mean they can't learn to talk or can't learn to potty train, or who knows where they'll be. And so my thought is always, we want each child to reach his or her fullest potential. We want each child. I have 2 sons. One is 23 with autism, severe autism. That's Lucas. And I have Spencer, who this weekend is graduating from undergrad and going to med school. He's 22. Both my kids, I want them to be safe as possible, as independent as possible, and as happy as possible. And I want each child to reach his or her fullest potential. And that bar, that fullest potential, is always increasing, and it's always high, and there's never a finish line until you die. So it's not like you are done. With each age and with each turn, there might be a new challenge, new opportunity. During the COVID shutdown, for instance, Lucas is home a lot more. He's not going to his day program that he normally goes to for 6 hours a day. So I just bought Hooked on Phonics. I mean, he can read simple words. He can spell simple words. He's not a reader. I don't expect him to be a fluent reader or read for enjoyment, but it can't hurt. Restarted Language for Learning because I had the kit in my closet, and I thought, you know what, we stopped that back in high school. Could that be a way to engage him and maybe get his sentence length up, maybe get his requests up? And I do think that it's actually working. So Kate is basically saying, don't just blame things on autism. Nothing has to be related to autism. And she also said, for professionals, a professional may be a great professional, but they may not be a good fit for your child. So I know a lot of my work, I'm trying to help parents not only learn to teach the child themselves, learn to be the captain of the ship, but also learn to identify what therapies are needed, what people are needed, how to work with other professionals so that they're a help, not a hindrance. And then when I asked Kate about self-care and like tips to reduce stress, she said she takes a lot of walks. I take a lot of walks as well. And now the weather is getting nicer in Pennsylvania. We're even walking more. But she gave me the one piece of advice that I wrote down and that night implemented was she said the stress in her house used to be really high because Cooper, her son, played his iPad really loud and it would just constantly be like ramped up the noise level. And so she found a volume reducer app that she put on her son's iPad so he can't raise it too high, and that way the noise level reduces. And I wrote it down. I was like, oh my God, I didn't even know there was such a thing. And Lucas wears headphones, but previously he would turn it all the way up and then he would get very overstimulated. So I was able to then, right after the interview, download, I think it cost $4.99, I believe, download this volume reducer app, and it literally has prevented all of his overstimulation. I also thought, because then he wanted a CD player so he could ramp that up through his headphones, and so I just put a piece of clear tape on. We shouldn't have to put up with things like that where kids are blaring music or blaring their iPads and getting overstimulated or making noise throughout the house. So that was a great little tip. So all of this, the podcast interview, you can watch it or you can listen to it by going to marybarbera.com/70. So loved the interview. I loved all my interviews. I also do solo shows. So solo shows or interviews. I also produce weekly video blogs, which tend to be shorter, just me on video, explaining one little topic. So if you are struggling with anything, you can always search Mary Autism and whatever you're struggling with, whether that's medications, stimming, tantrums, kicking, hitting. Just plug the word in and you will probably find a free resource that can help. Okay, let me go back and see if we have any more questions. Can we reassess this discussion afterwards by coming to this page? Yes, everything will be on this page. That's the nice thing about doing lives, is it remains on the page. And you can also comment or ask a question if you are listening and we're not live, and hopefully one of us will get back to you. And if you have a bigger question, just take the quiz, watch the free workshop, and then you can always email us through our website to get to customer support if you have a question that I'm not answering here. Or you can come next Monday and ask your question there. Kate says, I'm about to sign up for your course. Excellent. My daughter's 2 years, 9 months, and she's having 15 hours of ABA. If I implement your techniques, will this in any way confuse her or conflict with her ABA programming she's following? I think it's an excellent idea. Even if you had full ABA, 40-hour-a-week program, the more you can learn how to help your child 24/7 for the next how many years, even if she ends up, I don't know if she probably has a diagnosis if she's already getting ABA, but the more you can become the captain of the ship. Now, if your ABA therapy is aversive at all, if they are, she just has to learn to cry and you need to learn to get, that will conflict with what we're doing because we use a positive ABA approach. However, that doesn't mean you have to fire everybody. And we teach you within our course how to talk to professionals, how to get them. They can also take the course, or you can show them some of the video blogs or I think it's very complimentary as long as your ABA therapists are open to you learning, which they should totally be. If you learn to do therapy, it's just like if you took her to private speech therapy and they weren't in lockstep with your ABA providers. I mean, hopefully everybody's being positive and trying to get language, and it doesn't really matter whose idea it was. Like your child, you are your child's best advocate. So even if you learn something in the course and you start doing the shoebox program and they don't do that with her, show them, hey, look, I got her to say cat. I, got her to imitate. Oh, wow, we can work together to get that going. Especially during the COVID shutdown, a lot of people actually aren't getting the full therapy or aren't getting in-person therapy. And so this is allowing parents to really, see how empowered they can be to teach. I asked parents within my toddler and my other group, what struggles they were having since COVID shutdown. And 2 of the 9 people that initially replied to my post about struggles actually said, 2 people in the toddler course said, actually, it's great because we're shut down now and we now know how to teach. Before we used to rely on professionals to tell us what to do. Now we feel like we're a huge part of the team. So I'm glad you asked that question, but okay. All right. So I have a team member or 2 in here posting some links. Tanisha said, my 3-year-old daughter can sing along to cartoons, calls all animals by name, and thinks things that she loves is if she wants something. She holds your hand and points. Could this be autism? It could be. Taking an adult's hand and leading them to things is called hand leading, and that is can be a sign. I'm not sure if your daughter points with her index finger or if she did point when she was 18 months or 2 years of age. That's a failure to point with their index finger to show you things, like pointing to an airplane in the sky to get your attention. But we call the singing of songs or fill in the blanks to songs, we call that interverbal language. So it sounds like she has nice skills. So whether it's autism or not, that's the thing. It's like, especially with my toddler preschooler course, half the people that introduce themselves in the Facebook group, they don't have a diagnosis. They don't have a diagnosis yet. Maybe they're on a waiting list. Maybe they are just suspecting it. And maybe they're trying to turn things around before they even have to get a diagnosis. So I would still really encourage you to take the quiz. I know it's scary to use the word, I use the word autism a lot. And so some people that haven't even thought about autism get really nervous, or, the fact that your child's talking and then you can kind of talk yourself out of it. So knowledge is power. So the more you learn, the better she'll do, with or without a diagnosis. But like somebody did say, that is normal 3-year-old behavior. Sometimes it is. It's just if this is a hand lead or she's taking her mom's finger to point, that's kind of odd. And we also don't know what else she's doing, which could be normal or abnormal behavior. Another thing you could do is you could try to get a speech and language evaluation to see if she's truly delayed in a lot of areas. It's also how well she follows directions, how well she puts words together at 3. I mean, by 3, she should be pretty conversational. So if she's spending the day just singing songs or scripting for movies, then that is troublesome. Do you find that some people with autism have difficulty with fluidity and intelligibility when trying to generate novel speech? I've seen that language, and that's basically highly mitigated echolalia in much clearer than generative speech. Yeah, I think a lot of people have trouble putting sentences together, being completely conversational. My courses and my book and most of my video blogs are really for kids with very little to no language, talking in short phrases, getting them to be conversational. So I'm not really teaching how to get from fully conversational to completely verbal, with fluidity and generative speech. These are big increments. Michelle said, just received your book in the mail, The Verbal Behavior Approach. I'm so excited. Excellent. And now you have to remember, my book is 2007 published. It's in 13 languages. It is my ideas basically 13, 14 years ago. So if you want to get my ideas now, and I think, Michelle, you are in my courses, so you will get my ideas now. My new book's not coming out for another year. And by that point, a year is going to go by. So definitely learn about my techniques now and how I'm saying it now, because it's going to be, my book it was written as a classic, is great, is still selling better than ever. And everything in there, I still agree with. It's not like I completely changed my tune, but I have, with my online courses and my video blogs, people learn best by example, by showing you systematically how to do things. And I have probably over 1,000 videos of me working with kids with and without autism to demonstrate my techniques. And that sort of thing you just can't get from the book. But reading the book is always a good idea as a secondary source. Do the courses you offer teach how to implement ABA skills? Yes, they do. I am a board certified behavior analyst, and so all of my courses are based on the science of ABA. I also use my nursing background, my background as a nurse, mom, an advocate for kids with autism, and I am very much into helping parents be empowered to take the captain of the seat position so that they can teach their child and advocate for them regardless of diagnosis forever. My son just turned 4 and he's been diagnosed with autism. He first started with speech classes for speech delay. Now he's going to receive ABA and OT, but I would like to see if you could help me to understand what are those classes for. I'm new to all of this. Speech therapy is it can be individual or it can be in a group, but trying to get kids to talk. And ABA is the science of changing any behavior. And occupational therapy, occupational therapists usually work on sensory issues as well as fine motor, gross motor, dressing, those sorts of skills. But my courses and my work, I deal with all of it. I use a behavioral approach to teach language, dressing, feeding, potty training, imitation, play skills. And I work and have worked with multidisciplinary teams of professionals like OTs and speech therapists for many, many years. So what I have found is that if the parent can learn what to do for your child, you will be in a better position to decide on services, to decide what is the best use of your child's time. Okay, so let me jump back and see if I have any additional questions here. It's hard for me to get to all these questions, so if I missed your question, please either repost it or, if I don't get your question and it's a burning question and it can't be solved by you taking the quiz and watching the free workshop, then definitely email us through our website. We're in the UK. My son is nearly 4, nonverbal, but used to babble a lot when he was 2. Now has he regressed? Is this normal? Um, Regression is heartbreaking, and unfortunately, it is common, but there's a lot you can do to turn things around. So regression should not be a part of autism, but you know, when you're not actively engaging in the right direction and meeting new goals, the gap can get wider. So when my son first started showing signs of autism at 21 months, and I told my husband I never wanted to hear the word again, he was probably functioning at 9-month-old level for expressive language and 12-month-old level for receptive language, and he was 21 months. But we waited until he was almost 3 to get him actually diagnosed, and by that point, he was still functioning at a 9 and 12-month-old level, even though another 15 months had gone by. So while your son may look like he's regressing, the gap gets bigger. If you have a child who is, just making a slight increase up and they're so delayed, like my son was, and then typically developing 4-year-olds, are going straight up, and your son is just going barely up, the gap gets bigger. So if you have a newly 3-year-old who's not potty trained, that's not a big deal on standardized scores in life. But if you have a 4 or 4.5-year-old that's not potty trained, then that is definitely out of the normal ability. So, take my quiz and watch the online workshop. Our daughter was having traits when she was diagnosed with ADD. I think she was having more problems now than 3.5 years ago. Is there any point to see if there's more than some traits? Yeah, there's the ADOS test, ADOS, and that can help figure out if it's ADHD or autism. It is really hard to tell in some kids, especially when they're young. But it's definitely something that I've seen where kids have been diagnosed with ADHD and it's actually autism. And you might be able to get more services or have a more accurate diagnosis in terms of her needs if you go and get that looked at. But eyeballing kids and not doing an ADOS is sometimes you just end up getting a bunch of different diagnoses that are not accurate. Is it normal for a child to go backwards? My son, nearly 4. So I also go search Mary autism regression. I think I have some video blogs on that. My son is autistic. He's 3.3 and he speaks, but I have to ask him something. He doesn't respond yes and no. I covered this earlier. I have a yes/no blog. What is your advice for anxiety-based refusal to accomplish schoolwork on the computer at home? Some children have comorbid conditions like ADHD, pathological defiant ODD behavior. To me, as a behavior analyst, I like to just look at, doesn't matter what the diagnosis is. If there's refusal, it usually means the demands are too high and or reinforcement is too low. And you might think, well, no, he can do it. Well, it might be too boring. He might need more reinforcement. Reinforcement doesn't have to just be praise. Maybe he's getting too much free access to like computer, video games, and then when it's time to do homework. So in my mind, it doesn't matter what the diagnosis is. If you have any kind of problem behaviors, it usually means the demands are too high and reinforcement is too low. It is possible to do the one-page assessment online. We don't assess as part of my online course. We teach you how to assess on your own, how to make a plan, how to teach, how to evaluate whether it's working. So everything is online. You can do it at your own time. And the best way to learn more is to go through the quiz and watch the free workshop. I'm studying to become a BCBA, and I'm looking for resources for teaching assistants how to stay safe in the classroom without using NBCI. And I know that stands for something like a behavioral technique, but literally I do not know what NBCI stands for off the top of my head. Yeah. But looking for advice on how to stay safe in the classroom, I'm thinking you mean the NBCI is some kind of like aggression, safety care protocols. Yeah, we spend 95% of our time preventing problem behaviors, and I don't agree with escape extinction. You might want to listen the professional here that is interested in how to keep her classroom safe with maybe aggressive kids. I'm imagining is to listen to podcast number 7 with Dr. Megan Miller, marybarbera.com/7. We do not agree with a lot of the behavioral procedures that involve nagging, keeping the demand on, even for little kids. We want a positive approach. And so a lot of the techniques that you're probably worried about, like if you tell a big kid, do that, and he starts to get aggressive, you're pretty much not safe. And I'm thinking that's what you're asking. So listen to that podcast interview. My son is 2.8 years old, nonverbal, not potty trained, and won't eat anything. How do I enroll in the course? Yeah, take the quiz, watch the online workshop, and you can enroll. And if you have any questions, just email us through our website. Hello from Nigeria. My son can say a few one-syllable words like car and ball, but multiple syllables, he only says the first syllable. Yeah, so that's a great thing that you've identified. A lot of people talk about their kids speaking in 1 word or 2 words or 5 words, but you have the right idea, Jenny, from Nigeria, where we really want to look at the syllable length, because refrigerator is 1 word, but it's 5 syllables. And that is obviously a harder word. Bulldozer is a hard word. Words like with 1 syllable, like hi or bye or cat or hat, those words will come first. Even sounds might come first before that, like ah and e and o and ah. So we want to focus systematically, and that's what I do in all my video blogs and my podcasts and these and my online courses. So yes, there is a way. It's good that you have identified. Syllable length is really what we're going after, and I'm not a big proponent on increasing length of utterance. I did a video blog on why I don't like carrier phrases. Carrier phrases are I want, whatever, I see, that's a, those sorts of things can decrease articulation and they can increase prompt dependency. My daughter does hand lead, yeah. So that hand leading is a sign that it might be autism. And so it doesn't matter one way or the other. You need to learn what to do to systematically teach language while reducing problem behaviors, while working on things like eating, potty, sleeping, tantrums. It all goes together. It's like 2 sides of the same coin: language and learning skills and problem behaviors. And so that's really what I want to teach everybody through my work. What do you think about vitamin B12, D3, and folinic acid for autism kids? I did a video blog on supplements and medications you may want to check out. I am not an expert on supplements or the biomedical approach. So I rarely talk about that stuff, but I did do a video blog that might answer some of those questions. Okay, I think we are maybe not through every single question, but the most of them. Mario said, have you done any podcasts on what research is being done with regard to autism and recovery? I have a video blog on that has some statistics. So search Mary Autism Recovery. Okay, autism mom in Dubai. I have an extremely compliant, nonverbal 17-year-old, and he asks us before doing anything, how do I get him to just do it? For example, he will only get himself a drink after he asks us. So teaching a child, that's great that he's 17, he's very compliant. That's great. So you may actually want to explore taking our verbal behavior bundle course, because you could learn a ton about how to teach self-care skills. I would teach self-care skills in a chained method with task analyses, and that would help, but it's too lengthy to explain here. But take the quiz and watch the workshop and see what you think. But yeah, teaching independence, like hand washing, showering, dressing, those involve a teaching procedure without a lot of language. And then language is another way to teach. So as a child gets older, especially at 17, but even 5-year-old, 7-year-old, as you teach them hand washing and potty training and that sort of thing, we're going to want to shape up those procedures in a different way than we teach language. Okay. I think I saw one more question. All right. So I think we are done with most of the questions. So I think we are past the top of the hour. Thanks so much for joining us either live or if you're watching the recording. Thanks for watching. Let me know if you have questions next Monday, or like I said, you can always email us through our website and we'll be happy to help you. So have a great week. I hope you enjoyed this little Q&A and this little update on that podcast interview I did with Kate Swenson. That is marybarbera.com/70. She has some great insights. It's a great interview. So I will see you right here next Monday. Have a good one.